Good afternoon. Thank you so much for joining us today. I hope everyone has been having a good week. My name is Molly Garrone. I'm a Senior Communications Coordinator for the Choices Project at the Prevention Research Center on Nutrition and Physical Activity at the Harvard T.H. Chan School of Public Health. And as always, it is a pleasure to be facilitating today's coffee chat. So welcome to our Choices Community of Practice February coffee chat. Our topic for today is mapping your way to data-based decision-making. As always, I want to acknowledge our funders who make this work possible and also remind folks that our Choices work and events are for research and educational purposes only. The intention of our coffee chat today is to provide information, tools, and resources to inform and educate, and we're not attempting to influence any specific legislation. If you are new to the Choices Community of Practice, I'll just briefly describe what it is. The Choices Community of Practice includes people whose work focuses on advancing obesity prevention, healthy eating, and active living, and want to learn more about how cost-effectiveness analysis can advance their efforts and address health equity. And it's our goal at the Choices Project to support these efforts by providing tools, resources, and training opportunities. Our coffee chats are unique, informal opportunities to gather ideas, innovate together, and get to know each other better. Today's coffee chat will be focused on how we can use data to assess the health of a community and identify evidence-based approaches to address public health issues, which are key functions of public health departments. Our goals for this session are to highlight resources and tools to support data-based decision-making and public health planning, and also for all of you to have an opportunity to network with peers and learn from others about opportunities, challenges, and resources to support this work. We are very excited to be joined by Anna Clayton today. Anna is a Senior Program Analyst for Performance Improvement at the National Association of County and City Health Officials, or NACCHO. Anna has been working with NACCHO for the past 3 years and leads their MAPP portfolio for community health improvement. She has been working with her team at NACCHO to update the MAPP framework, including its guidance and trainings, and provides MAPP trainings and technical assistance to members. And prior to NACCHO, Anna provided capacity building assistance to local HIV organizations in DC, and she lives in Silver Spring, Maryland, which is just outside of Washington, DC. So welcome, Anna. We are so happy to have you with us today. At this time, I'm going to turn it over to Anna, and again, she'll be presenting an overview of the MAPP framework and highlight useful tools and resources available to support community health improvement planning. So Anna, please take it away.
Great. Thank you so much, Molly. It's great to be here with you all. Thank you for having me. My name is Anna Clayton, and as Molly was saying, I work with NACCHO. So NACCHO is a membership organization for the nation's nearly 3,000 local health departments. We provide training and technical assistance and funding and other resources to local health departments, local health officials, and their community partners. So today, I would like to share about how MAPP and the tools and the process of MAPP can be used to support data-based decision-making. So I'll provide information about the MAPP framework, the assessments and phases, and include some examples from communities who have used MAPP in the field. Although you might not work with community health improvement, the principles of how this process translates data into action are really applicable across different areas of public health. So don't feel like just because you don't work on a MAPP process or community health improvement that some of these suggestions and lessons can't be incorporated into your own work. So great to see that a lot of people, this is your first time hearing about MAPP. For those of you who have worked with MAPP before, I would love to, feel free to add your own things into the chat about how you've used these tools or use these practices. But if you're not familiar, MAPP is a community-driven strategic planning framework to improve public health. Overall, it has 3 broad phases. So you start by bringing the community and organizations across sectors together to plan for this community-wide strategic planning process and identify what resources you have to dedicate and what your goals are for the process. And then you conduct the 3 new MAPP assessments that I'll be sharing about to understand community needs as well as community strengths. And it ends by developing a community health improvement plan that's then implemented to target resources and address those priority issues and needs. And that's implemented with ongoing evaluation and course corrections as needed. So I'll walk through each step and describe how data is gathered and used in each one. So data-based decision-making really starts with making sure that you involve people who can help you access the right data that you're looking for. So as such, the first phase of MAPP is called Build the Community Health Improvement Foundation. And this is when you're trying to get the right people around the table. And we might define that as people and organizations who have information that will be helpful, but also some level of power and influence. So to expand on those, for information, we'd be looking to bring together partners for this. It's a steering committee in MAPP, but bringing together partners who can speak to what the community needs are and what the community strengths and assets are. So that might be people who work in healthcare or social services or other organizations who have actual data that they can share about what the inequities are or have connections to populations experiencing inequities. But it also could just be people who work in the community who have that, finger on the pulse of what's going on in the community and what people are saying. So sort of like well-connected individuals as well. And similarly with power and influence, we're thinking about involving people who have helpful skills to offer to move the process forward, or resources to dedicate, like funding or staff time, or again, data. So they can have this like formal power and influence, to be able to influence local policy change or dedicate resources. Or again, it can be people who have power and influence in the community to help bring more people into the process and make sure that we're really getting a diverse sample of what the community perspectives are throughout. So as an example of this, I pulled from the Community Health Improvement Plan of Partnership for a Healthy Fairfax, which is in Fairfax, Virginia. I saw on the registration list, we might have some people from Fairfax on the call today, so feel free to chime in if you want. But Partnership for a Healthy Fairfax is a coalition of community members and organizations who are working together to explore new approaches for addressing critical public health issues. So they were formed in 2010, and their work is guided by a community health improvement plan, which is from that assessment and planning process. And I've used an outline of their steering committee here to show how diverse types of organizations can help meet those different needs for what kinds of information and power and influence are helpful to have at the table before starting a process like this, or when you're trying to understand and address community needs. So you can see, based on their steering committee, they have people who can lend perspectives about community perspectives or social determinants of health or health outcomes and needs, or bring key skills to the process. I'll also keep using them a couple more times as an example throughout the presentation, because their priorities that they address happen to focus heavily on healthy eating and healthy environments and supporting active living, which might be applicable to the work that you're doing. So now that you have the right people around the table, it's time to gather data from the community from those multiple perspectives to make sure that you're letting the true priorities of the community and what's needed reveal themselves and involve the community in a data collection process. So this is called phase 2, Tell the Community Story, because we implement 3 mixed methods assessments that come together to tell the community story. So the first is the community partner assessment. I won't be deep diving into that one today, but it's a helpful tool for understanding how individual partner organizations in the local public health system are advancing equity and how they are advancing equity in their work as a full network of organizations together. So it's an assessment of the local public health system. The status assessment is quantitative, and then the context assessment is qualitative and can be used to dig deeper into the findings that you found in your quantitative assessment. And you use the findings collectively from these assessments to identify your top priority issues that your community will address over the next 3 to 5 years. So in order to help you make decisions that can impact inequities, we need to gather data to highlight what the inequities are. So the community status assessment is the quantitative assessment in MAPP. It explores these 3 categories of health outcomes and behaviors, social determinants of health, and systems of power, privilege, and oppression, or what we might call the root causes of the status of those social determinants and health outcomes. So what you would do is gather data from these three categories and do some disaggregation across the three to highlight where the inequities are. And that data helps you answer these questions in the pink box. So what's the status of the community across these categories? Who experiences inequities? And how do systems impact outcomes? So what's the impact of those root causes on the health outcomes? It uses both secondary methods like pulling from publicly available data or data that's already available is what secondary methods would be. So maybe dashboards or government websites, or you could do a request to a health department or health system for their surveillance data, de-identified surveillance data, and run different analyses like descriptive statistics or other statistical modeling to understand the indicators from those methods. You can also use primary methods, which might involve surveys. You can get a lot of data from easily gather data from a large number of people, or use observational methods. So each of these have guidance within the community status assessment to help you implement those different methods. As a note on indicators, the status assessment includes an indicator matrix, which is a document that outlines suggested indicators across these three categories that I named. These were identified by our expert subcommittee who we brought together for our MAPP update. So what I'm sharing today is from our MAPP 2.0 recent update to MAPP, but the indicators that were selected were based on their availability. So whether it's likely to be available at the state, county, zip code, census tract level, timeliness within the last 5 years, and significance to understanding public health. So just to note, some of these listed here, like under health behaviors and outcomes, there's so many in that category that these are like the subcategories, and then you'd have specific indicators under those. But the tool outlines how that indicator is measured, a source for it, and again, that geographic availability. But these are the recommended ones that you can explore among the three categories. As a specific example from Alexandria, Virginia, wasn't quite intentional to include only examples from Virginia, but it just happened to be the ones that I was easily finding that also had, like I'd noted, indicators that match perhaps some of the work that you all are working on. So you can see here the wide variety of categories that they included in their community health assessment. And in their appendix, you can see what the quantitative sources were that they used to provide information about those indicators. So you might find some of these applicable to your work. They have an indicator category around neighborhood and built environment and obesity, nutrition, and physical activity. And you can just see how many sources that they pulled from to provide them information about these categories. But additionally, in their assessment, they highlighted, sorry, on the next slide, I jumped in quickly, thank you. They highlighted the status of the disparities that they saw in these indicators, the progress on them to date, and whether they were hitting the benchmarks as intended for those indicators. So I also wanted to elevate this as a way to think about, when we're working on gathering data and trying to translate it into decisions, in the middle there, it's still helpful to just provide the data to the community in a way that is easy for them to understand how are we doing. So I just really liked this visual display. You can see at a quick glance how we're doing on each of the different indicator categories. So to help you understand maybe some of the inequities or issues that are rising to the top more deeply, you might conduct the community context assessment, which is the qualitative assessment and gathers community perspectives on the health status of the community. So this assessment looks at 3 domains. It looks at what the strengths and assets are in the community, how does the built environment contribute to health, and what are the forces of change. A force of change is something that happened in the past or is happening now or could happen in the future that would have an impact on people's health or their ability to achieve optimal health. COVID, of course, is a force of change, but also things like climate change is a force of change. There could be a local or federal policy change. So they're really broad, but those are the types of things we're talking about when we mention forces of change. So you explore these domains through these methods listed here, like focus groups or town halls or asset mapping, et cetera. And this assessment also outlines potential resources and steps you can use to work on those methods. So I won't go into deep detail on those methods today, but just want to note, we will link you to how you can download the assessment resources, and there's lots of information in there about that. But a couple of considerations for gathering useful data from a qualitative perspective is thinking about broad versus focused questions. So how you ask questions, or what questions you ask more accurately, just determines the data that you get. So if you ask a really broad question, like in this example on the left, what does a healthy community look like to you? That's going to bring up whatever is on the top of people's minds, what really matters to them about a healthy community, as opposed to narrowing in on something specific, like what are your barriers to eating a healthy diet, or what keeps you from getting enough exercise, which is another example from another recent community health needs assessment in Maryland. One isn't better than the other, but they just have their specific uses, and it's helpful to be intentional about when you're using either one. So if you're looking to see like what's really on people's minds and the community perspective on what the needs are broadly, then you'd want to make sure you're going for more broad questions. But having a specific question is going to allow you to dig deeper into maybe what is driving a particular inequity or access issue or something like that. So just might want to think about including both in that type of assessment. So in order to make good decisions with data, and particularly in MAPP with these three assessments, we want to consider all the data holistically and think about how each assessment only tells a part of that community story. So this is our data triangulation graphic in MAPP. It's a little complex, but really all it's showing is that on the left side, you have the three individual assessments, and we look at the data from all three assessments together and ask, okay, all together, what is this telling us about these orange boxes in the middle? Systems of power, privilege, and oppression. What is all the data together telling us about social determinants of health? And then we look at all those themes together and identify what strategic issues are rising to the top that seem to need to be addressed in the community health improvement plan. So that's important to consider, because we would have very different results if we just took data from a quantitative assessment and said, okay, these seem to be where the inequities are, so that's the issue and that's what we're going to address. So it's helpful to consider it all holistically. So now we've made it to phase 3, the final phase in MAPP, which is continuously improve the community. And this is when you actually go through the process of translating the data you've gathered into action by identifying what issues you're going to address and how you will address them. So the community prioritizes the issues for the community health improvement plan using issue statements. So for every strategic issue that you've identified from the assessments, you might put together a 1 to 2 page document that shows this is the data we gathered that led to us identifying this issue. This is what's been tried before to address this. And if we are to select this in our community health improvement plan, these are some of the potential interventions we might implement. So people can get an idea of like, what are the implications of selecting this issue for the CHIP? So you prioritize the issues so that you have a much shorter list, like 4 to 6. And then you develop goals and strategies for each based on your assessment data and insight from partner organizations and information about, what would be a reasonable change for us to see on this issue in the next 3 to 5 years. So you're gathering more data there. And then you implement the strategies and gather more data to evaluate how they're going. I wanted to make a note on this next slide about selecting strategies intentionally. So, sorry, next slide, please. Thank you. So this outlines criteria that's used in MAPP, but you could use other criteria to help you identify what strategies you're going to use to address those issues. So these ones that you can see here would tell you things like how feasible might this strategy be to implement and how effective might it be. One important thing about selecting criteria is you want everyone who's involved in this process of selecting strategies to agree on the criteria before you start using it, so that when you start kicking out strategies based on different criteria, you've all already agreed that like these are the things that are important to us in whatever strategy we're going to implement. So you could use others, but this is just a suggested list that I wanted to point out. So at this point, you've made it to the development of your community health improvement plan, which outlines the strategic issues that you're going to address, your goals for addressing those, objectives for each goal, and the key actions or strategies that you're going to implement to address them. Each component of this really reflects and is based on data that's been gathered about community needs, what would be reasonable to achieve, what strategies will be effective, and what is feasible for our community to implement. Separate from this, the community would have, or those involved in this process would have, a detailed action plan of, this partner is going to implement this action by this date, and we're looking to see a 30% increase in X by September 2024, or whatever it may be. But the chip that's shared out broadly with the community at the conclusion, or at this step of the process, is highlighting what are our goals and objectives that we're working toward and how are we working toward them. But I just thought, again, that Fairfax had a great example of making this something that's easy to reference and it's really clear and what the work is going to focus on. So data collection and thinking about database decision-making, data collection does not end with those assessments. Once you are actually implementing your strategies, you're still collecting data to understand, is this even working? Like, were we right that the strategy was going to target this issue, well? So you do both process evaluation, where you're evaluating, are we implementing the strategy as intended, and also outcome data to know if it's having the impact that you hoped for. And that allows you to make short-term changes so that you can have a better longer-term impact. So rather than waiting after 3 to 5 years to see if any of all the work you did was effective, want to keep gathering data to make sure it is effective, but thought that that was an important note to include, that database decision-making has a lot of data collection throughout the entire process, not only in our assessment phase. So overall, some thoughts on translating data to action, that thoughtful data collection really matters to help you reveal the priorities in the community, and that it continues during implementation. And overall, using data to determine how resources are targeted is critical. And hopefully these are some resources that help you identify those needs and set measurable objectives for seeing change. But there's a couple of considerations here that when we really commit to following what the data is telling us are the priorities that need to be addressed, it might involve letting go of some of the old priorities. Like maybe your community has always dedicated funding and time and resources to education access, and then come to find through a detailed assessment process that what's really needed now is more resources toward mental health care and support. That has some repercussions, like moving resources away from one area of public health work to another, or potentially changing the roles that certain partners play in that work. And that's likely to happen potentially when we aim to address the more root cause or social determinant level priorities, because that's work that cuts across partners and does not sit with one partner organization alone. So it's going to involve people working in new ways together. But ultimately, following the data means that you're using all the information you have to make sure you're meeting the community's needs. So for anyone who is new to MAPP, that's a really brief intro to MAPP. There's a lot more we could talk about MAPP, but I'd be happy to answer any questions that you have or connect in the future about it. And I look forward to our conversations today. Thank you.
Thank you so much, Anna, for that wonderful presentation and for walking through what the MAPP framework process is and sharing so many examples. And I really want to lift up your point. I loved how you talked about how database decision-making occurs throughout the entire process. I thought that was a really great point, and the importance of collecting data after implementation to know if it's really having the impact you were hoping for. So I think that, along with so many other great points, we really appreciate you sharing. So thank you so much for that great presentation. Certainly so relevant for this group and for our community of practice.